You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation that improves people's lives. Join us for an inside look at the change makers driving conversation and answering the most important questions in healthcare today. Thanks for joining us.
Hello, everyone, and thank you for tuning in. I'm your host, Beth Friedman, Senior Partner at Finn. I'm based in Atlanta, Georgia, and my guest today is Jeff Fallon. Jeff brings more than 30 years of healthcare experience to his role as Chairman and CEO of Evidion and Vibe Health. He's spent his entire career building solutions that really modernize the care experience inside the hospital, and he's one of our strongest champions for smart room technology. But what I really appreciate about Jeff is that he's also very passionate about respecting the investments hospitals and health systems have already made in their EHR and their other systems. So without further ado, Jeff, welcome to the show.
Thank you so much, Beth. It's great to be with you and your listeners today.
Fantastic. Glad to have you on. So we talk innovation on this show. And the area of innovation that you're involved with, of course, is innovation in that patient's room, which is so important. When you and I prepped for this radio show last week, I told you about my 4-month experience sitting in a patient room a few years ago, and it certainly wasn't very digital for me or for the nursing staff. So I'm really curious to hear from you today about what's new in the patient room with technology, especially as it relates to how we can help our nursing staff, because as you know, such a tremendous challenge there today.
Yeah. So there's so much going on in modernization of hospital rooms today. I mean, if you think about what's been done to just move from, I love this euphemism, semi-private rooms, meaning it's not private. So hospitals are transitioning from these, two plus beds per room to a private room for numerous reasons, clinical, but also in terms of patient satisfaction and patient expectations. But also, if you think about the patient expectations of technology in their lives today, and we carry these smartphones, these supercomputers around with us, and we have amazing information at our fingertips to get us what we need to know when, wherever we are. But when you are a patient in a hospital bed, you are incredibly uninformed generally as to what's happening, what's next, who are these people caring for you. So the interface in a patient room generally today is this 1970s technology they call a nurse call button. And I know there's some regulations around the requirements for nurse call buttons, and that's an important thing. But if you look at the chasm between the experience of information and control, certainly insight into what's happening through other things we navigate on a daily basis that are much less critical to what's happening in our lives than our healthcare, there's just this massive chasm. So, what we're doing at Evidion, and we've got this platform called Vibe Health, we're using smart technology at the bedside to just modernize that experience. And it's the next extension for moving from where we were to where we are expecting as Americans to be in our engagement in the process of receiving care, just like receiving every other service we invest in on a daily basis.
Absolutely. So definitely some good news for the patients. Now, what about, everybody talks about our workforce shortage, and especially the nurses. So tell me how digitization of the patient room, and what we're looking at now, how is that going to improve the lives of our nursing staff?
Yeah, well, you think again about that nurse call button, and it's got the perfect name, by the way, the nurse call button, because it's calling the nurse to do something that the patient needs. And, often those are really important clinical needs. There are, a patient in pain, a patient who needs clinical attention, but all too often those needs being expressed first by the press of a nurse call button are things that are non-clinical in nature. And the nurse is either responding with a glass of ice chips or a blanket, which is a wonderful, important need to be met. But it's not necessarily something that the nurse needs to handle, given all the other clinical things that are weighing on the nurse's task list. So, what we love to do with hospitals is to reduce the workload on that nurse, to take those non-clinical tasks off of his or hers task list and move them onto a non-clinical staff. So if it's a need for some food or changing the temperature of the room or the cleanliness of the room or something like that, that frankly are literally questions on the patient satisfaction survey, but best taken care of by somebody who's non-clinical in nature, and thereby freeing up time from the clinical staff, especially the nurse. So feedback we have from hospitals that we work very closely with on this kind of innovation is that not only do they see patient satisfaction increasing, but also, and very importantly, at least as importantly, is the nursing satisfaction increasing when they're having tasks like this taken off of their to-do list and left to operate at the highest level of their clinical authority. And then, if you think about that idea of reducing non-clinical tasks on that very important clinical staff member, overlaid with this really crisis that we have in just staffing, nursing staffing, and transient travel nurses and the cost of that, there's some very large and I think pretty visible levers available to improve that right there.
Absolutely. So relieving nursing, those non-clinical tasks off the nurses, but still getting that high level of patient satisfaction, right? How do we do that? And it sounds like you're using some of your technology, your smart technology in that patient room to really make that happen. Let's talk about it then we'll flip the coin. Let's talk about it from the patient and the family perspective, right? What are you hearing from your customers there? What kinds of unique things are you seeing happening in digitizing that patient room to address patient and family issues?
Yeah, so the beginning of what we do is often the TV on the wall of a hospital room. It's generally something that every hospital understands, and we all would as well as patients in a hospital room. There's always going to be there. Like, you're going to have a TV on the wall. In our case, we make that a smart TV and we connect it to the electronic medical record so that the TV knows everything about the patient, the demographics, and it personalizes an interface based upon those demographics. But the most important personalization is because of the clinical condition of that patient. We're prompting them to complete education that's specific to their admission, whether it's diagnosis related, medication, discharge planning, whatever the case may be. We're automating the education process for that patient in the bed. But if you think about many of the sites of care in a hospital, the patient is incapacitated, or maybe they're an infant and they're not yet aware and capable of being educated. Nonetheless, the family and the visitors that you're asking about are very important. Well, particularly in those cases, they're incredibly important stakeholders in that patient's outcome and their satisfaction as well, right? So what we're doing is not just on that footwall TV to help that visitor or that family be a part of the care, to be aware of how this patient is, what this patient is going through, and preparing them for life after the hospital. But we're also replacing the dry erase whiteboard on the wall of a hospital room that's, a manual device that's really critical to the quality of the care, as evidenced by the fact that it's a JCO standard, right? But we're replacing that thing with another smart display that's connected to the electronic medical record that is real-time information, real-time updated, and it's actually really dense with clinical information for the patient and for the nurse and the doctors who walk into the room. So in terms of a family engagement tool, I think we've seen that the dry erase ones are really critical, where families are writing questions for the staff on that dry erase board. Likewise, we're enabling that family to post questions and learn information about what's going on for that patient using the smartphone that they have in their own hand to interact with that whiteboard. So it becomes a really important tool for family engagement that's in the room. And whether it's a NICU patient or an ICU patient, or even a patient that might be in, an infusion chair for hours and hours a day, these kinds of smart technologies at the point of care, wired up to the IT systems that the hospital's invested in, are really critical information or really critical interfaces. And again, pointing back to the primary interface in the hospital room today is generally this nurse call button. It's just it's an innovation whose time has certainly come.
Mm-hmm. For sure. And my experience, I was that family member, right? My significant other had a massive stroke. So certainly he wasn't even able to see what was on the TV in the room, nor did he care. But it was very, it was there, and it would have been fantastic to have so much information there for me to be able to interact with it. But then also I think about health literacy. Like, one of the statistics I read recently is that we are still way behind with patients and patients' families, likewise, then on health literacy. So I can see a lot of applications for this in the patient's room as well.
Yeah, yeah. It's health literacy is such an important lever, and in some to a certain degree, I feel that there's an element of of the population that they seem to be unreachable. And I don't think that choosing to not attempt to reach them is an option. Certainly not, in terms of priorities and ethics and whatnot, but in terms of a value-based care delivery model, we have to reach them. And so using asynchronously delivered video to educate people about what's happening in their own time, when they're ready to receive it, rather than waiting for the nurse who they may or may not feel comfortable really pressing on and asking questions, using video to allow them to receive the education and consume it over and over if they wish. And get repetition for that information, and then be able to access it after they were discharged from the hospital as well, so that their friends and family who are their care team outside the hospital can also consume it and understand it and help them. This idea of consuming video to better understand stuff, it's just the way that we all receive information these days. I mean, the consumption of video, if you've seen the graphs.
Oh my gosh, the hockey stick, and first YouTube and now TikTok, right?
Yeah. Absolutely. Yeah. Well, we're not delivering education on TikTok yet.
Well, it depends who you are, I guess.
Yeah. Sorry, not clinical education. Anyway, we're not looking at that avenue, but boy, at the bedside, using tablets and the patient's own phone and the smart TV on the wall is absolutely, it's interesting. We work with hospitals who literally, so from the very broad spectrum of this is innovation that they've never seen before and they're excited about it, to this is innovation that's no longer optional, like not having our platform at the bedside would be like not having an infusion pump at the bedside. It's just that important clinical technology. If you believe that people simply want to get better and they need to understand to get better, then how in the world else are you going to bring them up to speed on how to care for themselves after discharge? You're left to do it face to face otherwise, and you're swimming upstream in the nursing staffing situation if you do that.
And then I think, like, the post discharge, right? I mean, trying to get that same education to that patient and the patient's family after discharge, how much more difficult, right? Much more difficult. So we're about midway in our show. I'll just say you're listening now to Finn Voices on Healthcare Now Radio, and my guest is Jeff Fallon, Chairman and CEO of Videon and their platform Vibe Health. So Jeff, I'd like to shift next to something I mentioned when I introduced you as our guest today, and that's the importance of digital health working alongside legacy systems. So, in other words, what I heard recently at the health conference in Las Vegas, disruptors must integrate with incumbents. I'm passionate about this. I've been working in hospitals since 1990, and really have seen all these now they're legacy systems. Back then, where they were the earth-shattering systems being implemented in hospitals. And I know how much hospitals and health systems have invested in all their technology. So just going to ask you, what do you see related to EHR integration in the patient room? And then secondly, as an add-on to that, how might that impact the tech stack? We're seeing a lot of consolidation in the tech stack in healthcare. So those two questions, the making the most of our legacy EHRs, and then kind of going forward, looking forward at the tech stack in healthcare.
Yeah, I heard a really interesting phrase from one of our clients a few months ago. He said that they felt that their investment in Vibe Health platform was about extracting more value from their very large electronic medical record investment. And so I think of EMRs, and I hope this is nobody takes this the wrong way. I really think of EMRs as like data plumbing. It's a database, and that doesn't mean they don't do great things that are really cool appliances too. But I know that what we're doing with Vibe Health is akin to a really smart appliance that sits on top of the kitchen counter, or sits on top of the hospital counter, so to speak, and plugs into the data that flows into and out of an electronic medical record and causes something different for the patient or the family, or the nurse who's in the room, so that this technology investment isn't just about putting a clinician in front of a computer screen and a typewriter and asking them to document what they did. It's about getting something more out of it, about getting new efficiency, new information, right information to the right place at the right time. So, for example, we've got one of our clients is using our digital whiteboard. As I said, we digitized that dry erase whiteboard on the wall, and we call it a digital whiteboard. And this thing, when the EMR indicates that the patient is coding, they're having a heart attack, the digital whiteboard automatically switches over into an entirely different display of information. That's mission critical data points for the care team that's in that room who is taking care of a patient who is coding. So that's a pretty good example of a really fast, highly contextual innovation being delivered at the point of the issue of the medical circumstance. In this case, it's life threatening. It's also quite important though when it's simply the patient took a pain med an hour ago, and we need to know what their pain condition is now, an hour later, and document that. And so we're able to interface with the patient and ask them for pain scores and things like that, and then alert the staff if somebody is in pain, so that their comfort is taken care of. Hopefully I answered that question.
Yeah, you did. So what I think I heard you say was, maybe it's bringing the EHR into the patient room in a very usable way for the staff and the clinicians, but maybe even also other systems, other applications that are mission critical for that patient, bringing those into the room as well. Is that something that you all are working on as well?
Yeah. So one of the things that is also a really an important efficiency tool for the staff. So that digital whiteboard or the TV on the wall, we're able to interface Vibe with real-time location systems, RTLS systems that many hospitals have invested in, whether they're Bluetooth or Wi-Fi, or even some really very cool, even advanced kind of smartphone technologies, so that when the nurse walks into the room, the whiteboard automatically switches to a certain display for that nurse, so that they've got the information that they need, right? And also, if it's a doctor walking in with an RTLS badge, we can actually pause the television and switch to a doctor view of the digital whiteboard, thereby nobody needing to ask the patient to pause the TV or turn off the volume or anything like that. So talk about getting the right information at the right point at the right time. It can happen because we're integrating with things like the RTLS system. It can happen automatically when they walk right in the room. And really, what drives us in these innovations is if the nursing staff is on board, if the nursing staff wants some sort of an innovation, if they have an idea, we're all in. Like we're trying desperately not to, build our own ideas. We're trying desperately to build ideas that nurses care very much about, because the nurses are the primary beneficiaries of this technology.
That's so interesting. So it sounds like what you said when the nurse walks in the room, the digital whiteboard recognizes that person and, switches over to what they need to see. That's pretty amazing.
Yeah, exactly. And there's not all hospitals have these RTLS systems, honestly. And we've got some other innovations in the works where, if they haven't invested in an RTLS system, there's other ways we can simply and easily and economically trigger that conversion of the whiteboard, so it's presenting just what that staff needs to know when they walk into the room. I'm thinking about other things that we're integrating with, like right now. There's a massive amount of interest and investment in virtual nursing is the topic. And the virtual nursing topic includes so many different things. It can be from virtual sitters, tele ICUs, virtual rounds, and there's so many different tools that are being brought into the room to deliver this value. And often, well, most times, these technologies require an interface in the room, and they often require a camera and probably a microphone as well. And hospitals, our clients are coming to us and saying, we really don't see having 3 cameras and 4 different interfaces in the room. You're already in our room. You're already our vendor controlling the interface for staff and patients. And so we're becoming the portal, basically the interface for all of these really promising, super cool technologies that the hospital wants to bring into the room. And we're proud of that. We're proud to be partnering with those guys and delivering innovations on a daily basis that are just groundbreaking. And there's more cool stuff ahead too.
Very exciting. And certainly talking about, multiple microphones and cameras in a patient's room. As a patient, I would find that a bit disconcerting to feel like I was under the camera all day long. So I can see where that's a big part of what you guys are doing, because you're kind of doing it the other way around.
Well, yeah, and actually that's a really good point, Beth. And that's one of the primary things I think that we're doing to make that standalone solution better. So if you put a camera, if you're investing in a telehealth solution, you put a camera in the room and it's going to watch somebody, whether it's a clinical visit or just a sitter kind of a thing, it's quite disconcerting. I'd be disconcerted. Golly, you're sitting there in a gown and you're, who knows what you're feeling like.
What you look like.
Yeah, exactly. So what we're able to do, because we're already the interface for the patient on the TV or the tablet or the digital whiteboard, we're able to let the patient know, hey, here's what's about to happen. We can take over the screen and say, Dr. Smith is about to visit your room, or he wants to visit your room. Or there's a little box in the corner of the screen that says, your room's being monitored. And when that's not on, you're not being monitored. We're simply interfacing with that patient and hopefully giving them a sense of comfort and even control. Like they don't have to just accept everything that might want to come knock on the door and walk in.
Sounds fabulous, both for the nurses that we talked about, but also the patient. Hey, Jeff, I want to thank you again so much for being on the show today. This has been really enlightening. I almost, not that I shouldn't even put it out there, right? I almost kind of want to go back to see a patient room now. It sounds like you guys are absolutely doing the right thing. Like I said, both for the respect of the staff and trying to support them, but then also, just keeping that patient in mind, patient's privacy and the patient family, and then literacy as well. So lots of amazing stuff. So thank you again.
Thank you, Beth. It's been really nice chatting with you.
So thanks again to Jeff Fallon from eVideon and Vibe Health for being on the show today. And thank you, our audience, for joining. Learn more about the show and previous episodes at our show page at Healthcare Now Radio. And follow the show's hashtag at #FinnVoices, where we're always talking about innovation in health and health technology. I'm Beth Friedman, Senior Partner at Finn Partners, based out of Atlanta, Georgia. Please follow me at HealthITPR on Twitter. I'm also on LinkedIn.
Finn Voices is brought to you by Finn Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact on the world around us. Learn more at finpartners.com and follow us on Twitter @finpartners.